Hello, and welcome to our virtual symposium, Getting Fogged In, When Lupus Brain Fog Hits. I'm Dr. Lindsay Springer, a licensed physical therapist, a partner with Kaleidoscope Fighting Lupus, and your MC for today's symposium. Today, we'll be hearing from two experts on lupus brain fog. They are Dr. Sharon Dowell and Arnita Roberts-Christie. Dr. Dowell is a practicing rheumatologist at Howard University Hospital, and today she will be describing the possible causes, symptoms, and treatments for lupus brain fog. Arnita Roberts-Christie is a registered nurse and patient engagement liaison with GlaxoSmithKline, GSK. She is a passionate champion for those living with lupus, and today she will share a number of tools for dealing with brain fog as well as other lupus symptoms. We'd also like to take this opportunity to thank our presenting sponsor, GSK, for making this event possible. So now, let's hear from Dr. Sharon Dowell.
Thank you, Lindsay, for that great introduction. Today I want to address lupus brain fog, which is a really difficult topic to discuss. Now, the effects of lupus on the brain can be really difficult to tease out because inflammation in the brain can lead to really severe effects. For instance, there can be strokes, which can lead to weakness in the limb or into the entire body. You can have seizures, or sometimes patients can actually have psychosis. But it can also lead to other conditions that many other people may commonly experience, like headaches, fatigue, confusion, memory issues, and difficulty concentrating. These symptoms can occur in isolation or they can occur together. So you often have to figure out whether it's due to active inflammation because of lupus or whether it is this sort of nebulous effect that we have no real treatment for. Today, I want to speak specifically about what we understand as lupus brain fog. And this refers to difficulty concentrating, processing information, and we may technically refer to this, or you may have seen it referred to as cognitive impairment or cognitive dysfunction. And this can be associated with lupus. In fact, brain fog can present in many different ways. Some people can complain of difficulty finding words or remembering details, or just difficulty processing information or concentrating on a task. It may be episodic, which means that it may come and go and it may not be constant, or it may wax and wane in how severely it affects you. The estimate for lupus brain fog or cognitive dysfunction in patients who have SLE in terms of prevalence ranges from 21%, which is like a fifth of people, to 68%, which is practically 2/3 of people, depending on which studies you look at. What we do know is that it affects a lot of people who have lupus. Now, current studies suggest that if you do suffer from lupus brain fog, the good news is that it tends to be stable over time and does not seem to be associated with some severe cognitive decline or decrease in your ability to reason. And in fact, one study actually showed that patients who were managed for their lupus over time, a period of 10 years, actually had an improvement in this lupus brain fog. Now, some others have expressed a slight concern for an increased risk of dementia in the future, but there's really been no clear association. Now, the underlying cause actually remains unclear, and this is because it's probably due to many different factors. There is some evidence to support an association with damage in the brain and damage to the very small blood vessels in the brain as well. In a study of healthy volunteers, they also found that high inflammation levels were associated with poor performance in cognitive tests. Now, this was not done in patients who had lupus, but we can extrapolate that inflammation or high inflammation levels can also affect how you reason and how you process information. And then there are other contributing factors to those of patients who have lupus, in that conditions like kidney disease or changes in your blood chemistries, which can occur in kidney disease or in some other conditions, can also affect the way you think and the way you reason. And there are medications as well that can affect your brain. So all of these factors can work together to really collude and to increase this sort of difficulty concentrating and this whole idea of lupus brain fog. Now, if you have these symptoms, it is important that you discuss this issue with your doctor. And the reason why is that cognitive dysfunction can be caused by other things as well. And so you should definitely always have an evaluation done and never make the assumption that it is because of your lupus. And when you see your doctor, they'll probably do a couple of things. They will probably review your medications, including any supplements that you're taking, to make sure that there are no interactions that can be affecting the way you're reasoning or thinking. They will also maybe evaluate your mental health, because depression and anxiety has also been associated with lupus brain fog. They will talk about your sleep and how you're sleeping, because if this is not controlled, this can also affect cognitive function. And in fact, there are some conditions like insomnia, where people just have difficulty falling asleep, or obstructive sleep apnea, where you may awake several times at night without even knowing it, which can also affect your cognitive function. We also know that active lupus can affect the brain. And so your doctor may want to make sure your medications are optimized, and they may also want to do tests to look for lupus activity, and they may also want to image your brain to make sure that there's nothing there to be found. And then again, there are other conditions like thyroid disease and diabetes, all of which can affect the way your mind functions. So it's important to talk to your doctor about these things. Sometimes when you see the doctor, they may elect to do what we call cognitive function tests by asking you a series of questions that really test your ability to reason and to recall information. And they may also send for imaging studies and do additional blood work. Now, there's really no real therapy for lupus brain fog, so it's important to make sure that your lupus is managed well, that you're taking your medications as advised, and that you're paying attention to your overall physical health. I would reference one particular study that showed an association between obesity and physical inactivity and cognitive dysfunction. So although more research is needed, we can also discuss the role here of exercise and healthy eating and mental health. As we have no real definitive evidence for treatment solutions for lupus brain fog, I think it's best to discuss an approach to how you can deal with this and how you can live with this. So I call this sort of an approach for success. Now, one thing you may need to do, or one of the critical things that you need to do, is to cultivate a supportive and nurturing environment, an environment where you can flourish. Lupus brain fog can affect your relationships, and it can affect your work activities and productivity, and it can affect your schoolwork. So you should advocate for yourself and request reasonable accommodations at work and at school. And this may involve having later deadlines for projects, or later deadlines, or more time to complete tasks. There's nothing wrong with doing this, and you should ensure that your employers or your supervisors know about this and give you what you need in order to succeed. And then you should also cultivate that support and understanding in your relationships. Make sure that your family understands how this can affect you, so that they will be more patient with you. And also, you can share your appointments or sync your phone with the family members so that they're aware when you have appointments, so that they can remind you or be there for you. Having a supportive environment can decrease stress and can add to your success. The other thing I want you to do is I want you to partner with your doctor. It is important that your doctor knows that you're experiencing these symptoms for the reasons that we addressed before, so that they can do a full evaluation and look for other issues, and also so that they can take a look at your medications to see whether there is some simple change that they can do that can make things better for you. They will also want to make sure that your lupus activity, that your condition is optimally managed and under control. The third thing is to maintain a healthy lifestyle. Now, we've mentioned this before, how obesity and physical inactivity can be related to cognitive dysfunction or to the lupus brain fog. So it's important to put strategies in your life that will lead to weight loss and to have a nice regimen for physical exercise. This could be as simple as going for walks or as cycling or going for a swim. Just do things every day and take time out to be thoughtful about your activities. Also, look to your diet to make sure that you're eating a healthy diet, rich in fruits and vegetables, and also that you're avoiding things that can be harmful to your brain, like alcohol. And for some patients, it may also mean avoiding caffeine. All of these things can potentially help to improve cognitive dysfunction and therefore help with this sense of being in a fog. Another thing you can look to do is to be mindful about sleep and how much sleep you get, as well as to look into mindfulness and strategies to improve mindfulness. There are exercises and ways that you can better manage stress. One strategy that I like is to surround yourself with positive people who can encourage and support you. And then also you can try to challenge your mind with cognitive exercises, or what we call brain games. Some things are simple to do, like taking a new way into work some days, right? Trying a new route out when you're driving, or just sort of like trying new activities to engage and to stimulate the brain. Be also mindful about your sleep and your habits around sleep. Avoid caffeine, avoid watching television in bed, and make sure that your nighttime routine is conducive to having a good night's rest. Now, there are other things that I think are important for you to do, and I call these your strategies for success. So knowing how the brain fog can affect you is important, and you need to find ways where you can work around this. For instance, if you're going to a doctor's visit or you're doing things, make a habit of taking notes in case you forget. Now, don't just take notes on a scrap of paper that you can easily lose, but make sure that you have like a diary that you take with you everywhere, or some sort of system on your phone or on a tablet where you have all this information stored. So take notes in case you forget things. Make a habit of making lists of things that you need to do. Use your phone for calendar appointments and reminders. And you can even do voice memos or voice messages for yourself to listen later in case you forget to do things. Before you go to your doctor, write down the questions that you have for your doctor as they come to your mind so that you can store them somewhere and bring them all out during the doctor's visit. And also during the doctor's visit, you can ask if you can record a conversation with your doctor so you can listen to it later in case you can't process everything that's being said during that time. Also, we talked about this before, you can sync your phone or your calendar with a close friend or your spouse so that they also will get reminders for your appointments and can be there to support you. Some other things that have been suggested is counseling and cognitive behavioral therapy. There are a few studies that suggest that this can also help to improve this whole sense of brain fog. But ideally, in addition to everything that we've talked about, it is important to find a supportive environment and a good support group that can help you along your way. I would like to thank Cultivating Lupus for inviting me to speak on this very difficult topic. I really hope that there are some pearls or nuggets here for you and that there are some things that can help you as you struggle with this condition. Thank you for listening.
Thank you, Dr. Dowell. That information was very helpful. Next, we will hear from Arnita Roberts-Christie. Welcome, Arnita.
Thank you, Lindsay, for the introduction, and thank you to Fighting Lupus. I am so grateful for this opportunity. My name is Arnita Roberts-Christie, and I am a Patient Engagement Liaison with GlaxoSmithKline, here today to use the program that Glaxo has developed called Us in Lupus. Today, we'll talk about some important ways to manage your lupus in your everyday life. We'll be sharing some practical tips that may help you live with your lupus just a little bit better. No matter how long you've been diagnosed with lupus, whether it was yesterday or many years ago, I believe that there's always something that you can take away from each presentation, and I hope that is true for today. Remember that this presentation does not take the place of you having a very frank, open, and honest conversation with your healthcare provider. That relationship between you and your healthcare provider is extremely important. So make sure that whatever you come up with, whatever you learn today, that you also discuss that with your healthcare provider. If you or your loved one has been diagnosed with lupus, you know that living with lupus can bring new challenges. Some of those new challenges can be daily, monthly, or annually, but there are many ways that you can be active patient or caregiver in your care. Some of you may be new to managing lupus, and others of you, again, already have been active and engaged in disease management. So today, the key is to learn even more about learning to live with lupus. If you're living with lupus, let's talk about your role. You play a critical part when it comes to your healthcare management and your healthcare disease. Within your role, it's important that you are engaged and informed. Those are two words that we at GSK haven't used often in our previous presentations. So just remember, engaged and informed. Optimal healthcare for chronic illness is made up of prepared and proactive healthcare team members with an engaged and informed patient. So not just the healthcare team members need to be engaged and informed, but you, the patient, needs to be engaged and informed. And we'll talk about what that means to your lifestyle as well. So what does it mean to be an engaged patient? An engaged patient is one who takes ownership of their health journey. That includes having the knowledge, practicing the skills, and showing the willingness to proactively manage your health and your care. Now, that definition could be like an overarching definition, but there are four main areas in which we can practice being an engaged patient. First is education. Knowledge is power, and we all know that all too well. As someone living with lupus, take time to continue educating yourself about your diagnosis, learn a little, and be willing to learn even more. You're doing that just by listening and attending this presentation today. Secondly, monitor and track your symptoms. You've likely heard this over and over again. Make sure you write this down. But I want to impress upon you the importance of writing down your symptoms and making sure that you're recording them. We'll talk about why this is so important a little bit later. We'll also talk about a form of monitoring your symptoms, and that's called health journaling. Thirdly, communicate with your healthcare team. This includes sharing experiences and participating in conversations and decisions alongside your doctor and your healthcare team. This is not a solo thing, it's a joint effort. It takes a village, we always say, to raise a child. Well, it takes a village of healthcare team members to help you live your best life with lupus. And we'll talk about that a little bit more as well. And then fourth, take ownership of your health and your lifestyle. That includes talking to your doctor about the lifestyle changes that are best for you. Lifestyle changes can be different for everyone. So, we're going to dive into some more details about lupus in order to educate ourselves a little bit deeper. While there are a few types of lupus, we're focusing today on systemic lupus erythematosus, or SLE. For those of you that have been living with this disease for a very long time, you know that lupus is an autoimmune disease, meaning that your immune system attacks its own healthy tissues. This causes inflammation, it can cause pain, and it can cause damage to various parts of your body. Those of you that are new to lupus will need to understand that there's something called an antigen-antibody complex. And when those two antigen and antibody complexes come together. They travel through your blood, and wherever they make a home, that's where inflammation and pain and damage can occur. And so both ways of understanding this, but making sure that we're all on the same page. Lupus is considered a chronic illness, and that's because it lasts for longer than 6 months. And this diagnosis, unfortunately, is part of your life. It is a lifetime disease. And lupus is usually characterized by what we call flares. That's when your lupus is aggravated or it's agitated, or remissions when your lupus goes to sleep. They also wax and wane, meaning they get elevated and then they go to sleep. So they get better and they get worse. From head to toe, lupus can affect various parts of your body. The signs and symptoms of lupus that affect everyone differently. Any invisible sign or physical symptom may mean that lupus is active within your body. And if you can see on the slide here, it has a number of different symptoms or areas where it can affect your brain, your eyes. And we're going to talk about brain and lupus fog in just a little bit. But you can have ulcers inside your nose, or you can have joint pain and things of that nature. Lupus is often known as an invisible illness as well. That means that you can have symptoms that others cannot see. However, there are some common symptoms of lupus that are invisible to outside of the body. For instance, not everyone can see the swelling in the joints, although you will feel it. Sores in the mouth or in the nose. There can be weight changes. Sometimes people may notice them and sometimes others, but you will notice them by the way that your clothes fit on your body, if something's a little bit looser or something's a little bit tighter. There are physical symptoms affecting the outside of the body in ways that you and your caregiver might easily recognize. There is the butterfly rash that occurs across the bridge of the nose and out into the cheeks, and that is one of the common effects of lupus on the skin. You can also have rashes on various parts of your body as well. The invisible signs of lupus are ways that lupus affects the inside of your body. Lupus can cause fevers and blood disorders, and one of those blood disorders can be called anemia. Signs of organ damage can include blood and or protein in the urine. There can be chest pain or shortness of breath. Any of these signs is caused by an inflammation to that particular organ. And remember where I said where that antigen-antibody complex gets together, and then when it moves through your body and wherever it decides to take up residence, that's where the inflammation will occur, and that's where we will see the symptoms. You may feel tired or extreme tiredness throughout the whole body that even when you go to sleep, it's not alleviated. As many as 80 to 90% of people living with lupus experience some level of fatigue. And I want to stop there for a second and make sure that, some people will say that, well, you don't look sick. And I was in New York and I was at a walk in New York, and the front of the t-shirt says, you don't look sick. And the back of the t-shirt says, well, you don't look stupid. And so what that tells the audience or whoever reads the shirt is that lupus is not always a look. You may look perfectly healthy or perfectly fine or perfectly normal. And I put those in quotation marks because those adjectives are subjective, but you may feel very uncomfortable in the inside, and know that your fatigue is your fatigue. And so one of the ways that you can really explain the fatigue is talk about it on a scale. So on a 1 to 10 scale, today I feel fantastic. I am at a number 10, and I may look like I'm number 10. Another day, I feel really low, but I still may look like a number 10. So if someone says to you, how you feeling today? I might say, I'm a 5 today. And that's your fatigue. And that's your reality. And help others around you understand, what's your 5 look like? Or what's your 5 feel like? What does your 10 feel like? What does your 7-8 feel like? And then your coworkers, your family, your caregivers, they will understand how you are dealing with your fatigue. Lupus can also have neurological effects, including headache, depression, seizures, stroke, as well as neuropathy, which is when you get the tingling and numbness in your fingers and in your toes. Keep in mind that all that I've just shared is not a full list of what you may be experiencing, but it is what you can experience with lupus. Now that brings us to the brain effects of lupus. And I read something the other day, and I just want to share it with you. It says, and I'm going to read it verbatim. It says, "Forgetting things every day is frustrating, but now I'm learning to fight this fog." So let's talk a little bit about what that means. Cognitive dysfunction or brain fog is a common symptom of lupus. In fact, about 50 to 80% of lupus warriors may experience brain fog. Brain fog causes issues with memory, concentration, and attention. For instance, you might say, well, now, whose phone number did you just start dialing? You're dialing the numbers, and they're not on automatic in your cell phone. So, okay, what number was I just dialing? Or you're walking out of the bedroom and you're going into the kitchen and you're like, okay, I'm not hungry, but why did I come into the kitchen? Or why did I come upstairs? Or why did I go downstairs? These are all examples of issues that may affect your memory or your concentration or even your attention. When there's a lot of external stimuli coming at you and you may say, wait a minute, I can't focus on all those things. It's too much for me right now. This is where your attention, you may notice that something's going on with that. You may be left feeling confused and have a hard time focusing on a conversation or even a task. You know, some people say, oh, I can multitask and I'm really good at that. Well, for me, I need to do one task at a time. Maybe you do too. And that is okay. I want you to understand that whatever we're experiencing, whatever we're feeling, it's okay. Because number one is you're not alone in that feeling. There's others of you in this world that also feel this, that also experience this. And if you're experiencing these symptoms, it's important to take note and to discuss them with your physician. All of these experiences that I talked about could indicate to your physician that your lupus is aggravated, that it has been woken up, and that the physician may need to do some type of intervention with your care. Remember that new symptoms or a flare of old symptoms, again, could mean that your lupus is becoming active. If you struggle with memory loss or if sometimes you have trouble concentrating, take that cue, take that time, write it down. Write down the day, write down the time, write down the situation or the scenario that you remember that's going on at that time. And remember, this can be frustrating. We get it. We understand. And yes, you are not alone. But I'm hoping that you're going to learn some ways that you can fight this fog. I want to share with you a quote from a lupus patient and connect you to our Us in Lupus Facebook community. And this quote says, one lupus warrior commented on our Us in Lupus Facebook page, and they said, lupus is definitely an invisible disease. Through it all, we have to keep pushing. Comments like this, I hope, help remind us that there are many lupus warriors out there fighting this fight, the same invisible illness, and no one is left to fight it alone. I want to talk to you now about symptom tracking. This is the next chapter in which I want to talk about what does it mean to track your symptoms. I mentioned before that this is one way in which you can be more engaged as a patient. And understand that I just said more engaged because I want to make sure that we Acknowledge and identify that you are already engaged. But can we make you more engaged? And we're going to talk about tracking, and one way that we can use this is by something called health journaling. Keeping track of every symptoms as lupus affects your body in many ways you may not even recognize. Tracking involves monitoring your disease activity, working with your doctor, and keeping it under control. Remember, we want you to control your lupus, not have your lupus control you. And we want you to work to reduce long-term organ damage. To start, consider a symptom and how it occurs. How long has it last? And how severe do your symptoms feel? Keep track in a way that works for you. That could be a calendar on your refrigerator. It could be a book in which you call your health journal. It could be an app on your phone. It could be a notebook, a loose leaf notebook that you get at the dollar store, or anything that you feel comfortable that you can use to track your symptoms. And lastly, consider taking time to practice talking about how your symptoms are impacting your life. Because if you're having symptoms, in some way, they are impacting your life. For instance, if your fatigue is at a 10, you may wake up and have to put your feet on the side of the bed and sit there for a few minutes before you're able to go into the bathroom. That means that your symptoms of fatigue are impacting your life, and that is something that your physician should be aware of. Health journaling is one way in which you can keep track of your symptoms, and so much more. I actually journal not only for my health, but I also journal. I have 2 children. I journal for them too, because this is a way that somewhere down the road, they're going to look back and say, well, Mom, what was it like when I was 16? And I could go, well, let me look back at the journal that I kept for you, and I can give them example. Oh, well, you were something else at 16. But if I didn't have that journal and I depended on my brain and my mind to remind me, I may not have as much detailed information to share with my children. And the same is true for you when it comes to your health. You may be able to remember bits and pieces, but you may not be able to remember the level of detail that can be helpful in order for your physician to make changes to your care if they are needed. With lupus, there can be a lot of aspects to keeping organized. In a health journal, you can make notes of your diagnosis journey, medications, changes, ups and downs, dosage changes, lab tests, procedures that you've had, symptoms that you're experiencing, triggers that you did not know existed until it brought on a flare. Emotions, how are you really feeling? Today is not a great day. Why is that so? Can you identify what's going on with your body, whether you can feel it or whether you can see it? What's happening? Where is your mental state? We are in a space in this country where the mentation of our bodies is really under attack from a number of different ways. We are isolated from those that we love. Is that isolation a little bit too much for you to bear? Let someone know about that. Don't face this period in your life alone. There are resources that can help you. There is a support system. Us in Lupus has a community. Kaleidoscope Fighting for Lupus has a community. Let's get you connected. Let's make sure that you are not fighting this alone. And through a health journal, you can track how symptoms are affecting your life. In several studies, writing about stress and emotion, also called expressive writing, may have clinical benefits for patients with autoimmune disease and inflammatory conditions like lupus. And so when you write how you feel, you are expressing your inner emotions on paper. And that's what expressive writing is. Writing can have a healing effect. It does for me, and I hope that once you begin that process, that it will for you too, because it's taking what is happening on the inside and you're able to project it onto the paper. You can make entries in a journal, and that can help you organize your thoughts and help you to manage some uncertainties, especially if you're feeling a little bit anxious about something. Writing it down helps to kind of take that anxiety out of the physical body and put it somewhere else. And what better place to put it on paper? And that way you can share that with your healthcare provider. Over time, your journal entries can help you and your healthcare provider provide a more accurate picture of how you are living with your lupus and how your lupus is affecting your daily life. To get started with health journaling, there are a few which I think are very easy steps. First, find a journal format that works for you. We talked about whether you're writing it on a large calendar, you're writing it in a notebook, you're using an app on your phone, you're using the notes section on your phone. Whatever it is, there's no one way, but there's one way for you. And that way is the way that you know that you're going to be consistent with it. And then set up your journal with your health history and your goals. Do you have goals for yourself about how you're going to manage your disease? As you set up goals for yourself, then make your journal entries part of your routine. Let's say it's part of your morning water. You have a glass of water and you write in your journal. Or perhaps it could be your evening routine where you're going to silently meditate for 2 minutes and then you're going to write in your journal, or vice versa. But find a time each part of the day that works for you. And, let's say 7 days is a really big goal for you. How about try it 2 days a week? Try Tuesday and Thursday. Let's start there. And then you may find, well, I can do this Tuesday, Thursday. Let's throw something in there. How about Tuesday, Wednesday, Thursday? And what I'm trying to share is that as you start to consider what you can achieve in terms of goals, you may find that your goal will expand from 2 days to 3 days, from morning on one day, evening to morning and evening. Your journal entries can include signs and symptoms of lupus, just like your joint swelling, if you have fever or rash, or any other common symptoms. You can also track your blood sugar, you can track your blood pressure, you can track your weight, you can track, again, we talked about your emotion. Where are you mentally? What are you feeling? What's surrounding you as you're feeling all of this? What is your quality of life when you are, your symptoms are at a 2? What is your quality of life when you're at a 5? What is your quality of life when you're at a 10? What are your goals for your quality of life? All of this information can be tracked in your health journal. And then when you're at your doctor's appointment, share your journal with your healthcare provider. You can use your journal to prioritize what questions to ask and what you want to discuss with your doctor. Plus, you can keep notes of recommendations in that journal. Let's say you have a list of questions that you write down, and then you go to the doctor and they give you some answers. You write those answers right where the questions are, and that can even trigger your mind to say, okay, I have another question, and write that down. But the important part of this is to make sure that you are keeping that journal. And so I'll ask you, do you have a health journal? And hopefully by now, I have kind of edged you on to say, I don't have a health journal, Arnita, but I think I'm going to get one today. Okay, so we've talked about journaling. We've talked about symptom tracking. Now let's move into lifestyle. Now we'll get into some of the more day-to-day management tips for living with lupus. I'll touch on 3 different areas, and I'll touch on 2 different practices. So we'll talk a little about nutrition, we'll talk about physical activity, and we'll talk about sleep. And then the 2 practices that we'll talk about are mindfulness and self-appreciation. First, let's talk about nutrition. Have you ever heard the term, you are what you eat? What you feed your body, also know that that's what you're feeding your brain. As we talk about nutrition, your body is made up of several systems that work to keep you moving forward. What you eat and drink affect how your body functions. Food can have effects on your body which are positive, and I don't like the word negative, so we'll say which are not so positive. How about that? Maintaining healthy nutrition doesn't have to be difficult at all. You do not have to have a card at your most favored health food store in your area. But what it does mean is eating and I don't like the word diet, but it's eating a diet that consists mostly of fruits and vegetables, lean, healthy meats and foods of that nature. It also means that, sometimes people can refer to that type of diet, if you will, as a heart-healthy diet. Studies show that eating a healthy diet can help with nutrition-related chronic diseases like obesity and heart disease and high blood pressure and osteoporosis and many others, and also autoimmune disease such as lupus. There's no one particular diet that fits all lupus warriors. There is information out there in the literature that talks about foods that can help decrease inflammation, but there's not one particular diet for everyone, and that's primarily because lupus affects us all differently. Lupus has been called a fingerprint disease, and I like to think of it as a snowflake disease. Every snowflake is unique and different, and so is every one of you lupus warriors living with this disease. So you have to do some trials and see what works for your body in terms of your nutrition. Your doctor may recommend changes to your diet, and you can start the conversation by asking what foods to add to your diet or to be mindful of which foods for you. You may be interested in adding a nutritionist after you've talked with your healthcare team. There are a few general tips for healthy eating that you may consider. First, try to get a better understanding of your caloric needs or your caloric intake based on your activity levels. The United States Food and Drug Administration provides guidelines about consuming a 2,000 calorie diet, but your needs may be different, and so it's important to talk to your doctor to find out what are your needs. In speaking with a nutritionist, I was learning that when you go into a grocery store, try and stay on the outer aisles of the grocery store. That is where you're going to find your fresh fruits, your fresh vegetables, your grains, your proteins. The inner aisles are more of where you will find your processed foods. The foods that are processed are foods that may have been cooked or canned or frozen or may have had additives or preservatives added to the food. And those are the ones you want to stay away from. But let me be clear, if that is where you are financially or economically, then that is where you are, and it's okay. The most important thing that I'm trying to share with you today is to make sure that you are striving to eat foods that are healthy for you. Foods that are perhaps a little bit lower on the sugar or sukar, a little bit lower on the sodium intake or in the numbers that are on the packages of the foods. And I would, just kind of implore you to look at the foods, look at the packages of the food, look on the back of it and see what's in the ingredients and how much sugar is in it. If sugar is the first ingredient on some foods, it may not be the food that is best for your body. You may need to add vitamins or supplements or minerals to your diet. But most important, before you add any new supplement or any new vitamin or make any changes to your diet, please, please, please make sure to talk to your doctor about what is best for your body. I want to share another quote from a visitor to our Facebook page of Us and Lupus, and she offers advice on how to manage your lupus lifestyle. She says, keep a log of your symptoms. Watch what you eat and what you drink. When there is a symptom, be sure to log what you've eaten so you can track your flares, because foods can also cause flares. Many lupus warriors share advice on the Us in Lupus Facebook page that you can read at any time. All that you have to do is go on your smartphone or on your computer to usinlupus.com. So let's continue a little bit more with lifestyle, and let's move into activity. Being active is more than just waking up and walking and working out and doing exercises. Activity includes being physically active that gets you moving, whether it's in everyday life or through purposeful training practices, even like a dance party. I love to just put on, my favorite song and I just start moving. And before you know it, I have moved around for at least 15 minutes. I love it. I've been active. I've lost a couple calories burned a couple calories in the way. But the most important thing is that I have been active. So activity doesn't mean that you have to go to some formalized thing where you're having a trainer or you're swimming symmetrically in a pool. Activity is important for you, for your physical as well as your mental health. Getting moving can help your heart, it can help your joints, and it can help strengthen your confidence as well as your mood. If you find a song that you love from when you were growing up, you'd be amazed. Just try it. You're not in such a good mood. Just try putting in that song. And I'm pretty sure that when you're finished listening to that song, your mood has changed. And I do hope that it has changed for the better. The Centers for Disease Control recommends 30 minutes of brisk activity 5 days a week. But your body may be different, and the needs of your body may be different for activity as well as rest. So talk to your doctor before you make any changes to your current physical activity. The same as with nutrition is the same as with physical activity. Make sure that you have a conversation with your doctor. And then get your party on. Get your party started. Now, let's talk about some ways that you can stay active. To bring more activity into your life, consider a few of these tips. First and foremost, a consultation with your physician. Think about your goals. And are you trying to improve your heart health? Are you trying to improve your lung strength? Or are you trying to improve your flexibility? Are you trying to gain strength or are you trying to gain endurance? Are you trying to lose a certain amount of weight or are you trying to maintain a certain amount of weight? Start with a simple goal because research has shown when you start with something simple, you're more inclined to stick with it. If you start with an activity that you really, really like, you're more inclined to stick with it. So find those songs that you really, got you going when you were younger. Have them on a continuous reel, if you will, and say, okay, for the first 15 minutes of my day after I do my journaling and have a glass of water, I'm going to play a certain song. And so this can be part of your routine. But whatever your goal, don't make it so that, you beat yourself up if you don't do it. Have a little grace with yourself, have a little compassion, love yourself with it and say, you know what? I missed it today, but tomorrow is a new day. Or even later today is a new opportunity that you can do this. You can start to explore things like dance or like yoga or even, brisk walking or walking slowly, walking to the end of your street as opposed to walking around the whole block. You can listen to music, you can listen to podcasts, audiobooks, all of those things. Believe me, when you're doing something and you're listening to something, it totally distracts you from your time and you'll be amazed at how much you can do. Lastly, remember that people with chronic illnesses may have better experience with low impact exercises. So ask your physician, what are some of the low impact exercises that I can start with? And those low impact exercises are less stressful on the body while still being effective. And usually no equipment is required. So we've talked a lot about the importance of getting active and a few ways that you could use to motivate yourself and get moving. So I want to ask you, how do you plan on getting active if you're not active already? Do you have a favorite activity that you like to do? Think about it for a second. Now this brings me to sleep. The importance of sleep. Sleep is essential for restoration and recovery throughout the body. You spend, or they say you should spend, about a third of your day sleeping. And since one day has 24 hours in it, and sleep recommendations are usually about 8 hours, that leaves 16 hours a day that you can work, you can play, and you can plan for a good night's sleep. And notice that word, plan for a good night's sleep. Your sleep needs are unique to you. Consider discussing them with your physician. If you have challenges in going to sleep, talk to your doctor about that. The timing, the duration, and the quality of your sleep can be so important in terms of it being factors for your health. If you do not get enough sleep, that can have such an impact on how you go throughout your day. And think about it. If you're not getting enough sleep, you wake up in the morning and you're a little bit groggy. And let's say your fatigue or your symptom level is already at an 8. So now we've compounded a high symptom level with not enough sleep. That compounded effect can have a negative effect on your body and your quality of life. So sleep can affect your metabolism. It can affect your weight. It definitely can affect your immune function, your disease resistance, and your overall quality of life. So spend some time thinking about how much sleep do you get and how much sleep do you need. So on the slide are a few tips that you can consider to help you meet your sleep goals and wake up feeling rested and refreshed and restored to meet the demands of the day. First, understand how much sleep you need. Have you found a personal magic number for the hours of sleep? I can tell you, I thought I was so energetic, I only needed 5 hours of sleep. But one day I decided to just not put the alarm on, and I ended up sleeping more than 5 hours. And it said to me, I'm like, I thought I was doing really good on 5 hours, but perhaps I can do even better with 7 hours. That may or may not be you, but I want to share, something about me that may hopefully help you. Keep in mind that each day is different and could bring different moods, different stress levels, and different physical feelings that may require an additional amount of rest. Next, I want you to think about staying consistent with your sleep schedule. 5 hours here, 4 hours here can add up really quickly. Try and strive for the same number of hours each night. And that's actually what I have done, and I can tell you it does make a difference. You may not think so, but try it and see if it makes a difference for you. That may mean going to bed and waking up at the same time each day, and that includes weekends too. Sometimes we like to sleep really late on weekends, but if you keep a consistent waking and sleeping time, you will see that how your body will become accustomed to it and that your body may even crave that. When you're getting ready for bed, on the previous slide, I talked about a plan. Make sure that your room is sleep friendly. Well, what does that mean, Arnita, sleep friendly? You may find a dark room with a cool temperature can make you feel very relaxed, or a dark room with a warmer temperature may make you feel relaxed. Keep in mind, too, that an electronic-free room can keep you from staring at your TV or your cell phone late into the night. And there has been information that has been printed in the literature that when your eyes are busy looking at the television or busy looking at the phone, that it takes an extra amount of time for your body to relax and wind down before you can get to sleep. So think about turning off the television or, not looking at your phone for at least 30 minutes before you want to go to sleep. Not before you lay down, but before you really want to go to sleep. Try training your brain with a nighttime routine that is relaxing. You can consider reading, listening to music, stretching, meditating to let your body know, okay, Arnita, it's time for rest. It's time for you to leave the busyness of the day, to relax, get into a zone because it's now time to restore the body. Be mindful too of your naps. It can be tempting to rest whenever you're sleepy, but instead, if you need to take a nap during the day, plan to sleep for just about 30 to 60 minutes long and well before your bedtime. And then that will have the body able to make sure that you get the best out of the longer sleep time that you're going to have later. Now I'd like to introduce you to an area which is very dear to my heart, and that's talking about mindfulness. Mindfulness is one method you can use to practice relaxation, to practice stress relief, and to practice lifestyle management. Mindfulness is defined as an awareness of the present moment, your thoughts, your situation, all without judgment. The key to practicing mindfulness is to be in the present with acceptance and without judgment of yourself or of your situation. Mindfulness is used in the practice of mindfulness-based stress reduction, or it's also called, you may see the acronym MBSR. These techniques of mindfulness may have mental as well as physical benefits. So let's talk a little bit more. What is it like to practice mindfulness? I would say it's really simple. Mindful breathing is a good place to start. Sometimes when we think about mindfulness or we think of practicing, we may think of yoga. We may think of someone who's sitting crisscross applesauce, thumb and first fingers are touching and they're going, But that's not always the case. It also is being mindful of your breath. It is simply getting comfortable, whether you're sitting or you're lying down, closing your eyes and starting to take some smooth, deep breaths. If you have a watch that shows you, may or may not show you what your heart rate is, and let's say your heart is pumping, and you said, I really need to relax. Close your eyes for a moment and take some slow, deep breaths. And then look at your watch again and see what your heart rate is. If you take 5 slow, deep breaths, I'll almost guarantee you that your heart rate will decrease. Your heart rate will slow down, and your mind may start to feel a little calmer. You can focus your brain on what your breath feels like as it travels in and out of the body. And when we think of brain fog, think of the confusion, all the external stimuli that may be coming in. How about taking some deep breaths to recenter your thoughts, recenter your brain so that you can think of one thing at a time in terms of your focal point? You will be surprised at how much it kind of brings things together into one focal point so that you can move forward. Mindfulness may be new to some people. Have you tried it before? And if you have time, if you can stop the tape where you are, stop the tape and do 5 deep breaths, just for Arnita's sake, and see if it decreases your blood pressure or decreases your heart rate. This last area is an area about self-appreciation, and I love the smile of this woman on this slide because it shows someone who has found joy And that joy can come from inside when you take time to appreciate your lifestyle, appreciate who you are, where you are. And this can be a major part of lupus lifestyle and something that you can remind yourself of daily. Remember that living with a chronic condition can be hard work and requires self-love. It requires self-confidence. From the time of your diagnosis to today, you've been dealing with a new and changing reality of what your life is with lupus, what your life is like with lupus. You've been through peaks, you've been through valleys. It's like sometimes you feel like you're on a roller coaster, and that can be tough. The brain fog can be frustrating. But I encourage you, try and stay positive and confident while being kind to your mind and to your body. Loving yourself, appreciating yourself. I've mentioned us and lupus several times during this presentation, and what you have before you are what we call QR codes. There are several different areas on the Us and Lupus website, which if you have time, I really would encourage you to go on the website and investigate. For instance, there is an area called Living with Lupus, and that's what we call our Thriving section. There's an area called Talking About Lupus, and that's what we call our Connected section. How do you communicate via verbally or non-verbally? An area called Finances and Lupus, and that's where you are determined to not let that hinder your progression and how you take care of yourself. There is a section called The Basics of Lupus, where you are getting educated, where you are getting informed, and understand that it's not just for you, the lupus warrior. It is also for the caregiver. It is also for your village that surrounds you, that want to know, how can we better support you? How can we help you? How can we understand what that word fatigue is? What does it mean to have sores or ulcers in your mouth? What does it mean to have about an inch of your hairline just kind of go away? What does all that mean in terms of how it's interacting with your body? There's also a section for caregivers, and we call that section the supported section. But, take the time to just go and investigate. You can either hold your phone or your pad up there, or you can go on to the Us and Lupus URL. We'd like to, I encourage you to stay connected with us. You can check out this website. You can look at the Facebook page. You can look at the Instagram. All of these areas are here to support you. And lastly, as a lupus warrior, there is also a lupus warrior guide for uncertain times. In this guide, you can take a lupus activity quiz and read more about communicating with your telehealth and your self-care, and about loving yourself and appreciating who you are. I would like to take this time to thank all of you for just making time for you and learning a little bit more about your lupus. And I hope that you've taken something away from this presentation that you didn't know before, or perhaps you've moved away from something that you were doing before, and now you understand how it can be helpful, whether it's symptom tracking or health journaling, or eating, more nutritious foods, or getting that extra sleep that you need to restore your body. And of course, maybe it's taking the deep breaths to be mindful of where you are in your life. I want to thank the board of directors, as a special thanks to Tori Brown and to Greg Dardis, as well as all of you on Kaleidoscope Fighting Lupus for this opportunity. Thank you so much. Continue to take care of yourself. Continue to be healthy. Stay safe and stay well.
Thank you, Arnita, for providing that information on how to deal with so many aspects of living with lupus, especially the invisible symptoms like lupus brain fog. This brings us to the end of our symposium. Getting fogged in when lupus brain fog hits. We hope you found this discussion and the resources helpful. Once again, a special thanks to our presenters, Dr. Sharon Dowell and Arnita Roberts-Christie. And thanks to our presenting sponsor, GSK, and to Kaleidoscope Fighting Lupus for their continued support of those living with lupus. Finally, we want to thank you for watching. We encourage you to visit our website, www.kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, information on our programs, award-winning blog articles, and much, much more. Thanks for spending time with us. I'm Dr. Lindsay Springer for Kaleidoscope Fighting Lupus. Please take care.